Welcome to Chiro Thoughts, where we talk about everything chiropractic and health. I am Dr. Adrielle. This is Dr. Justin Berlin, and today we are talking to you about infertility. So there's a lot of people that struggle with infertility. A lot has been going around. I have seen on social media different ways to implement lifestyle decisions just to help with fertility. Some people that I know that have struggled with infertility, so we are here to help you if you are struggling with that. First, we want to define what infertility is. According to the CDC, it is defined as the inability to get pregnant after 1 year of trying. The CDC also says that about 1 in 5 women, which is about 19%, are unable to get pregnant after trying, which is about 6.1 million women in the US, which is a ton of women. Obviously, we know God created women to reproduce, so there's a possibility to get these women to at their optimal function and get them to be able to conceive without any issues. So in that 1 of 5, so 6 million women, 26% of those women actually have difficulty carrying their pregnancy as well once they do conceive, if they do conceive. So also that's a pretty high percentage of women. And I think I also heard a stat, it's 20% miscarry with their first pregnancy as well. So a lot going on physiologically. But did you want to go over the most common causes of infertility?
Yeah, I think, first, I don't know that we've addressed this a whole lot in our podcast, but I think one thing to kind of clear up is, when we talk about chiropractic infertility, what does chiropractic specifically have to do with chiropractic? So I always like to talk about the fact that chiropractic is not a treatment for infertility, right? For so sure. I think that's, for people to understand that chiropractic is not a treatment for anything, right? So how we talk about infertility with chiropractic, it could be back pain or headaches, or we talked about GI, all of these issues, and we may have touched on this with GI, but chiropractic's job and its role is to allow the body to function at 100%. And so the question with whether, again, it's GI, whether it's infertility, is somebody infertile because the body's not functioning appropriately? So I think it's good to clear up, right, to say, hey, we're not talking about treating infertility, like chiropractic doesn't treat any condition or disease. Chiropractic's job, again, to allow the body to function optimally so the body can heal itself. So, basic neurology says the brain controls the entire body, every function, every organ. Right, the first chiropractic adjustment restored a man's hearing, had nothing to do, chiropractic doesn't restore people's hearing all the time, right? Chiropractic's job allows the nervous system to function. So I think
within the limitations of that person's matter, essentially, depending on age, their lifestyle decisions, that is within the limits of how your nervous system can function
for sure
with each individual person.
And I think that the confusing part there is, if you would ask me what's the number one thing that somebody can do that has infertility, I would say get adjusted, right? But just like everything, it's not treatment, it is restoring the body back to its normal state of homeostasis and allowing your organs to function properly, right? Your brain has all the information, has to send the information down the spinal cord, out the nerves. I don't know if you saw my brother's podcast the other day. He was talking about the brain being the tree and the roots, right? That you can't cut the tree off at the roots and expect anything to survive. And that goes for infertility. So if there is lack of communication, right, between brain and body, that you have to look at the communication. How is the body functioning? So I think that's a big point to make, because I think it's huge with infertility, is that we have an epidemic of lower back pain, of spinal related issues. We have an epidemic of infertility, and I think that they're very closely related. They're linked. So I think that's a big point to make, that's how we want to address it, is how do we get the body at its best, functioning at its best.
Sure.
So, you talk, when I think of the two main things that I think of with infertility is organs that aren't functioning properly, and then lifestyles that are out of control, right? So probably one of the biggest things with infertility is hormone imbalances. And where do hormone imbalances come from, right? Your nervous system, your endocrine system are the same system. So your brain has a portion, right, the anterior pituitary, that secretes hormones, stimulates the hypothalamus, sends that information through the nervous system to get end organs to function. And that is your adrenal glands, that is, ovaries and testes. And so it's impossible to have normal hormone balance without having normal neurologic function. And so I think that is absolutely number one where I would start to say, where did the imbalance come from? Hormonal imbalances. What is the other things that cause hormonal imbalance? And it is lifestyle. And so to me, those are the big two that we need to focus on. Always, 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 can there be a problem with an organ? So I do know people who have underdeveloped uterus, right, where it may not fully function. That is a difficult situation. Somebody born without a fallopian tube, but they're extremely rare. When we're looking at 19-20% having issues with infertility, this wasn't the case years ago. So there's lifestyle factors that go into it.
And lifestyle factors being nutrition, getting rid of toxins. There's multiple people that I've heard of who have had PCOS and completely healed their PCOS by food, just nutrition and getting rid of those toxins. So a lot of hormone disruptors in just our everyday lives that is creating that imbalance.
So what are the big hormone disruptors, right? Number one, I would say that in my experience is overweightedness and obesity, right? So your hormones are fat sensitive. So the more body fat you have, the more hormones your body will produce. And so when you have excess body fat, your body's producing, right, typically too much estrogen, progesterone, and then your organs, the endometriosis, the PCOS, you have a rampant amount of changes hormonally. So, right, heavy menstrual cycles, or too much or too little there, and again, what I'm thinking of is, like endothelial tissue, right, or uterine tissue and hormone-sensitive tissue outside the pelvic cavity, right? And whether it's on the ovaries, and so it becomes a big issue there. Body fat, and then of course you said endocrine disruptors. They're super common. Birth control medications, cleaning supply, environmental toxins is how I would say that, and then diet. Those are the big ones.
We also wanted to mention that men can contribute to infertility as well. So same thing, lifestyle decisions, diet, exercise, highly processed foods, alcohol, seed oils. We talk about a lot of that. Same thing, being overweight, not maintaining a consistent exercise routine. All of these things definitely lower testosterone, which is not helping with that fertility. So men, can also be a huge contributing factor for sure.
Yeah, I would say in that there, again, my experience is most of the time when men have low, sperm motility or count, they're back before you, but when I was a kid, there was a big talk about how Mountain Dew decreased sperm count. And so that was, high sugar stimulants, right? And so that was kind of like a common thing that people, quit drinking Mountain Dew, it'll decrease your sperm count. Well, it's a toxin, right? It's a heavy toxin.
Mountain Dew different than any other toxic drink out there?
Yeah, no, not really, right? Red Bulls, energy drinks in general, Monsters. I mean, these things loaded with sugar, loaded with all kinds of toxic chemical soup is what we like to call it. So that's a major issue there, but men have the ability to decrease their testosterone mostly through lifestyle factors. So we get men who are not exercising, right? They are toxifying their bodies, pretty stressed out.
Too. Yeah, stress is a big one.
Yeah,
like
as far as
keeping your phone in your pocket, like the radiation.
Yeah, for sure.
To the epididymis.
you hear that. I personally, I don't know if you've come across any research on that, but it is definitely, it's talked about, right? Where are the Wi-Fi, the different signals, is it messing with, proper cell function?
Yeah.
Right?
I heard that sperm count is down 50% from 20 years ago.
I wouldn't doubt that.
That is so crazy.
Yeah, the last 20 years have brought a lot of changes in our world.
Yeah.
And that is, right, technology, diet, absolutely, less physical exercise and activity, right? I mean, men, right? I mean, people in general, sitting at a desk, eating lousy food. We talked about the different food choices like seed oils, right? The omega-6 seed oils are huge for toxifying, creating systemic inflammation, along with increased sugar intake, you name it, right? So there's a whole lot of environmental factors.
Yeah, not doing us any favors. Obviously we mentioned earlier, the nervous system contributes majorly to just reproductive organs. We talked about specifically the bladder, reproductive organs, and lower portion of the gut receives parasympathetic innervation from S2 to S4, which are segments in the sacrum. So we want to make sure that pelvis is properly aligned to prime you in your body for conception. So in addition to not only nerve-related things, obviously we know that stress, like you mentioned earlier, has a lot to do with hormones. So obviously many of us just have everyday stressors, physical, mental, emotional. Whether that's chronic or acute, this can put the body into a state of fight or flight, which we've talked about many times before. That sympathetic fight or flight mode, where your sympathetic nervous system is, thinking that it's being chased from a bear. There's no difference if you're in a chronic state of stress. When the body perceives this stress, the hypothalamus, like you said, tells the pituitary gland to downregulate hormone production, specifically follicle stimulating hormone and luteinizing hormone, which are critical for women's menstrual cycles. But we know that the body will always go into survival mode over reproduction mode. So when the body doesn't feel safe, ovulation doesn't occur, and then there's no eggs released, there's no empty follicle to produce progesterone, which should ideally peak 6 to 8 days after ovulation, I guess I should say. And we question, why is progesterone important? Well, that also has a calming effect. It's a steroid hormone made from cholesterol. It's pro-sleep, it's anti-inflammatory. And so when you aren't ovulating because you're under stress, and then you're not producing progesterone, it's kind of just like this vicious cycle of irregular cycles, no libido, anxiety, headaches, migraines when you have that low progesterone. So it just kind of spirals into more and more stress, and then less and less progesterone being produced. So chiropractic, on the other hand, works to balance out that sympathetic parasympathetic state to make sure that the hypothalamus and pituitary gland are properly communicating to get your body down into a lower stressful state, more parasympathetic function, calming yourself down to make sure your body knows that it is in a safe place to be able to conceive and bring that baby into a stressless world. And that your body is capable of not being under a bunch of stress while you're also going through pregnancy.
Yeah, right. So again, when I hear that, and there's a lot of big words in there, but chiropractic's role is normalize nerve function to normalize end organ function. That's number one. But I think what you were just alluding to is chiropractic's role is also in hormone function to reset the nervous system, right? So not only can we have, people, I think in the chiropractic world, we think of a bone sitting on a nerve, and then the flow of that nerve to the organ. Well, of course, the organ can't function because the compression to the nerve. But stress creates, I almost think of it as like static in a phone line or something, right? Where stress on your body creates neurologic static. And this is the inability to communicate, where the adjustment not only will open communication to the organ hormonally, right, reproductive organs, but then also decrease the stress on the nervous system. And so those are the big three areas that I, hormonally
so
and organ function.
Communication to the nerve, reducing stress, and then also regulating hormone.
Yeah. And it's not just something, again, like we're trying to produce our testimonials along with these because we've had lots of patients over the years who have the inability to conceive. And I would definitely say more women than men, because there seems to be more of a neurologic process with women's infertility and more of an environmental or lifestyle factor with the men's that I've seen. But I mean, at least a dozen over my years where inability to conceive for months and or years, most of them years, start getting chiropractic care, and within 6 months, I think all of them that come to mind that was a topic of starting care have been able to conceive. And so it's not just something, right? And it's very hard to measure that. Hey, we started care, we were able to conceive. Well, they were doing other things as well. It's definitely part of the process of normalizing function. So it's huge. And how devastating, right, to not be able to conceive can be for some people and families. And so,
and I think a lot of times when women come in, they have tried every other thing, lifestyle related. And so, chiropractic might be their only hope, which I think that's a great foundation. We talk about in doctors report that the foundation of all of these other lifestyle choices that you can be optimally benefited from starts with a properly functioning nervous system. So if that's functioning great, then all these other choices that you're making with those lifestyle decisions are going to be benefited, exponentially.
Absolutely. Yes, right. You can decrease stress, you can eat better, you can detoxify, you can do all the things, but if there is a neurologic communication issue, infertility will persist. On the other side, if infertility or if nerve communication is normalized and organs are functioning properly, those other lifestyle factors would make much more impact on the body because it's a normally functioning body. So we would love to be, even if we're your last chance, chiropractic is great at being people's last chance.
Yeah, when I was looking through studies, I know you said that you've seen a lot of women over the course of 6 months. There was a study that I saw, 11 women looking at their course of care over 5 months. The majority of them were able to conceive. So I mean, it might take a little bit of time, but it is definitely well worth it. And then you'll most likely see a lot of other areas of your life improve as well. With,
absolutely.
Just different visceral functions and, energy, proper sleep, all of those things, regulating stress, like we mentioned. So
I think, most people presenting, they always think that they must be missing something in order to not conceive. So it's, what do I need to take in order to conceive? And I think it's very backwards that most of the time there's too much coming into the system that ought not to be there. And so it's getting back to, normal function would be conception, right? Relatively easy conceptions. All the things that we do in this world that we've named, the stress level, improperly functioning nervous system, toxification, overweightedness. And so how do we restore a body back to its normal state of function? And it usually is cleaning up your world. And so I think those are some major lifestyle things. If we can get people exercising, especially doing some strength training, if we can get everyone down to maintaining their best healthy weight where their hormones aren't out of control, because the fat, visceral body fat, then signals the body to produce those hormones in excess most of the time, right? And then detoxifying is so important.
I think there's
important.
a lot that people don't realize have such a huge impact on their hormone levels. And it is very, very pertinent to identify those things, like we mentioned, with just toxic cleaning supplies and perfumes, even fragrance in your hairspray or shampoo, and things like that have a huge impact. Those Glade plugins drive me absolutely insane. Just different things like that. And, you know, everyone was kind of conditioned to think, well, if it's on the shelf, then it must be fine. You know, they're selling it. But those things are not good. They're not doing us any favors.
So how often do we hear that this, whatever it is, Glade plug-in, food, is an endocrine disruptor, right? So we know plastics are a major endocrine disruptor, right? We have plastic, all of our, a lot of our Tupperwares, things that we're heating our foods in, the plastics, endocrine disruptors. There was research years ago that said canned food, they actually spray your cans with plastic, and so the canned food, that has higher levels of endocrine disruptors.
Even the ones that say BPA free, they did a lot of testing, and they're not BPA free.
And this is why most people are now using metal drinking containers or glass drinking containers, not plastic, because it was all the endocrine disruptors.
But now there's lead being leached into those as well.
And the PCBs, we talk about PCBs. So again, years ago, there was some research that said the frogs there was way more female frogs than male frogs because of the toxicity of our water supply. So I do think this can seem very overwhelming, but it has to be one step at a time, right? Clean up your water, filter your water, making sure you're getting the PCBs and all the toxicity out of your water. And then it is back to more natural foods. Again, it all points in the same direction. I think if you, instead of focusing on how do I limit all of these problems, it is what should I be eating for health in general, and that is fresh fruits and vegetables, clean meats, whole foods, and that prevents you from having to look at all these other, getting rid of the packaged foods, the canned foods, and that's where a lot of our things are. What are we cleaning with? Are we cleaning with vinegar? Are we cleaning with a natural cleaning supply, or are we toxifying our world with all of the chemicals? I think it was 2017, I'd have to look this up, I had read previously that the FDA, I think it was the year 2017, had approved more than 15,000 new chemicals that could be put into our food supply. And so you look at a label and you see 100 ingredients and you can't pronounce the great majority of them, that we're adding lots of toxins to our food, and the FDA is approving it and saying it's okay, but not till 10, 15, 20 years later do we realize, man, we're creating cancers, we're creating endocrine disruption and infertility, you name it. So detoxify is, and really it should be as easy as getting back to the basics.
Yeah, exactly. On our social media, I had posted a couple practical tips a couple weeks ago, and one of them was just get rid of one bad thing and implement one good thing. Even if it's, you're doing that once a week, it's going to take a little bit of time. If you do have a lot of, toxic endocrine disruptors in your life currently, or in your family's life, just take out one bad thing, implement one good thing, and you guys are heading in the right direction.
Yeah, I think anyone could look at that and say, okay, hey, we've been struggling for 2 years, hypothetically, 3 years, haven't been able to conceive. What steps have you been taking, right? Where can we guide and assist? Number one is nerve function, right? Proper hormone control, and then start cleaning up our lifestyle. And I would be shocked that we don't see massive improvement overall.
Cool. Any last thoughts?
I don't think so. I think I said all I need to say.
Okay, sounds good. Well, that was Chiro Thoughts, episode 5, chatting about infertility. If you guys have any other topics that you'd like us to cover, we'd be happy to. Just shoot us a DM. Until next time, guys. Thanks.